my second best career advice, and I use that regularly in my career now, is slow down, take time to learn, take time to observe, and the rest will take care of itself.
This is the Medical Sales Accelerator Podcast, featuring tips from top performers, delivered like a conversation over cocktails. Listen in to glean wisdom from the best of the best and accelerate your results for years to come. Now, here are your hosts, Zed Williamson and Clark Wiederhold.
Welcome to the Medical Sales Accelerator Podcast. This podcast is for you if you care about driving growth in your numbers in the MedTech space.
My name is Clark Wiederhold. I'm Chief Sales Officer for Trackable Med.
And I'm Zed Williamson, CEO of Trackable Med.
What do you do when you're in a physician office and your meeting was 25, 30 minutes ago? You're looking around, patients are frustrated. What do you do at that point?
Today, we're going to talk to someone who has some excellent advice and answers for your interaction with the practice that goes much deeper than just the physician. Today, we're talking with Amy Smith, Senior Director of Marketing at Neuros Medical. She brings a wealth of experience from many leadership roles in both marketing and sales over her career. Throughout her time in MedTech, Amy's responsibilities have placed her in positions of strategic account management and physician practice development, giving her unique insights into practices' processes and procedures that both help and hurt patient experiences, as well as the business of the practice itself. She lives in Dallas, Texas, and has 2 adult daughters charting their own careers these days. Welcome, Amy.
Thanks. Thanks for having me.
Absolutely. So, Clark asked the question, you're sitting in the office, you're waiting to see the physician. What insight could you gain?
I think the most important insight that can be gained from sitting there is, rather than getting frustrated, you're on a time schedule, you've got another appointment, is actually taking that time to sit back and observe what's actually happening at that practice. You're usually obviously in the waiting room, watching the patients themselves who are sitting there. Are they happy? Are they frustrated? Are they continuing to go up to the front desk asking questions? You have the window into the front desk person, the very first person that greets a patient when they walk into that practice. Are they polite? Are they short and curt with these patients? If the front desk person is also the person answering phones, which is often the case, are they constantly interrupting a patient who's at their front desk right in front of them to answer a phone call coming in? Does it seem to be harried? So I think it's just really taking that time to collect yourself and observe what's going on around you to be able to provide those insights to the physician later. The physician doesn't have time as the business owner, essentially, to really observe the practice as a third party looking at his or her own business. So you can provide those unique insights at the right point with that physician that you're meeting.
So you're saying put down the Better Homes and Garden magazine from 1989 that's been sitting on the table since 1989 and
Correct.
Pay attention. What's interesting, I've made this mistake over and over again. In business, we think we have this thing we have to achieve. So we are laser focused, got to talk to the physician, got to talk to the surgeon, got to move those mountains. And we miss so much. And that's what it sounds like you're talking about, is there is just fields of gold.
Yeah, and take out your notebook and make some notes or note them in your phone as you're observing all these things. And it's not going to be the first conversation. If this is a physician they've never met, it's certainly not going to be the first conversation to go in and say, hey, this is what I observed. But it's more gathering data for later. Or if it's a customer of the reps that's a regular customer, then perhaps you already have this relationship to become a better business advisor to this physician and be the eyes and ears that they don't have. Watching over their practice and helping become a business consultant instead of just a rep that shows up and talks about their product and leaves, or ask why you aren't using more of their product versus a competitor or something like that. Like, can actually deliver true value to this business owner.
Amy, that's so spot on. I wish somebody earlier in my career had given me that advice, because at least for me, so often walking in as a rep on the business development side of things, I'm looking around and a lot of the training was, talked about using that time wisely, but it was all from a competitive perspective.
Mm-hmm.
If you have a competitor at the time, do you see a competitor's brochures in the waiting room? Do you see the practice marketing any type of other procedure or therapy in the waiting room? What are the telltale signs that you can pick up and glean some insight from that perspective, but never from the actual processes and the business aspect where you can be more of a consultative resource for that practice? It's interesting. So, Amy, you've gathered this insight over years of your career. When you see things that are breaking down and you make those observations, what do you do from there?
I think it starts, I think it's twofold. So if you're a rep and you're in that situation, whether it's an existing customer or a new customer, I think you, first of all, have to gain some knowledge of how a medical practice works. So this gets to your point, Clark, you just made. Invest in developing knowledge of what are all the roles at a medical practice, who plays which role at that particular medical practice, just through your interactions. So you have to build a base of knowledge so that when you now share these observations and learnings about that particular practice, it makes some logical sense to the physician. So you have to each practice is a little different. They tend to have the same roles and responsibilities. At a given practice, you have an office manager, you have people answer the phones, you have people that get the patients roomed, you have others that support procedures or other things with the physician. Sometimes you have others like nurse practitioners or PAs that are involved. So at that particular practice, you first have to learn how it works and who's responsible for any given observation that you make. So you might observe something happening at the front desk, but really somebody else was supposed to have come to get that patient and take them back, and they missed on their part. So you have to take the time to understand how medical practice works, make the observations at a given practice or physician or customer you're working with, and then be able to translate that and be the eyes and ears and business consultant that at some times, and maybe many times, the physician doesn't even know they need. So there's very few physicians, at least in my experience, that are very good business people. They're not trained to be a business person. They're trained to be a physician, especially those in procedural or surgical subspecialties. But now all of a sudden they're a small business owner and they know to hire the right people, meaning from a responsibility standpoint, I need an office manager to keep all this going. I need somebody to answer phones. I need somebody to room patients. I need this, but they don't have the time even in many situations to even assess on a daily or regular basis how that all of it is working together, because they are a part of the business process, an integral part, seeing patients, doing procedures. So they get very focused on that aspect of their role within the practice and don't have time to step back and look at it overall as like the CEO of that practice. They don't function like our normal, more standard businesses.
Sure. I had a customer in the past give me some insight. It was powerful, and he didn't even realize what he was sharing with me. He said, I've got to go load trucks every day. And that's the way he phrased it. And really what he was talking about is what you kind of asserted to. If they're not being that integral part of the patient experience and the process within that practice or the business that is that practice, then things aren't rolling. And essentially what he started to discuss is the trouble he had working on the business because he was so deep in the business every minute of every day. So that the revenue engine would roll. And I've really come to appreciate that struggle that a lot of physician customers I've had over the past 10 plus years have had to deal with.
Yeah, they have a full-time job seeing the patients and then doing whatever procedures or other things that need to be done as the healthcare provider in that practice.
Yeah.
So then when they go home, most of the time they're updating their notes, updating charts. So when do they have time, in their day-to-day world? So if it's done well, a salesperson and other people within a company can serve as a very valuable business partner that, again, they may not even know they need until you provide that insight to them.
And there's not a lot of other people for that surgeon to talk to. So maybe there's a rep out there that's nervous about bringing business up, but just asking a question, hey, how's the business going? How are your people? How's that? Man, the connection that you can create is really deep because that person doesn't get to go discuss that with anyone else. I kind of view it as it's like a mechanic who owns a business. You are literally under the car the entire time.
Mhm.
And I think I'm in a lucky position because I get to think strategically about trackable med for hours upon hours. And man, it would frustrate the heck out of me if I couldn't do that. So I know it's got to be tough for these physicians.
Yeah, and I think all of us in business have gone through, in more traditional business, have gone through periods where, as a leader, where you would like to spend most of your time being strategic and thinking. Maybe you have turnover, maybe you have things going on in your business. You have to jump down into a very tactical level. And for most of us in those positions, after a while, that's very frustrating. And to a business, it can be debilitating because everybody's got a skill set. So it's beautiful to bring a skill set of strategic thinking from outside the business that serves as this consultative role, and everybody's needs align. The reps, the business, the physicians, and their practice. And of course, there's a lot of relationships that you have to build along the way to be able to give that advice and have it be actionable. So you can't steamroller the office manager in the process or other staff members. You have to build these relationships and make them the hero in their individual roles at the practice so that everybody is winning, and most importantly, the patient. And I think that's really the advice I wish I had gotten early in my career in med device is if you take care of the patient and treat them and make sure they're treated just like you would want to be treated if you're a patient, everything else will take care of itself. The revenue will come. If you're the rep on the other side of that revenue stream, you're going to get your sales, your quotas will be met, and everybody plays a role in ensuring that patient and that patient's experience is world class.
I've often wondered how many of our physician customers think of their business as a service business, because on the patient side of that practice, that's how you view it. I mean, yes, it's healthcare and it's extremely important for a lot of different reasons, but it's really a service oriented in business, and the practices that seem to keep that paramount in their mind always were doing better from a pure business perspective. When you're behind the counter and you have relationship and you get a deeper look under the hood, Amy, what specifically are you looking for when it comes to the patient experience and the patient flow throughout a practice? What are you looking to identify so you can glean some insight and maybe pass on some wisdom to the practice?
I think observational, just simple things like how do people talk to the patients? Are they curt? Are they short? Are they abrupt? Do they take the time to answer questions, for example? Or are they just trying to get that person through the door, off the phone, whatever that is? So there's that emotional piece, which is just observing how people interact with others. And then there's, from a business perspective, I think, observing the flow and efficiency of the practice. So if the physician would like to increase revenue, if the rep would like to increase their sales, you have to take all of these learnings and apply them towards efficiency. So some of the observations you might make, for example, if the front desk person is the person answering the phone, they're necessarily going to be pulled in many directions. Do I put the priority on the person calling to make an appointment, or perhaps a current patient who's having a difficulty, or do I put the priority on the person who's standing here at the front desk in front of me? So perhaps the advice to the physician is, hey, I know you don't want to add some costs to your business, but I think you would actually do yourself a favor and the business a favor to hire a person to answer phones and a person to work the front desk. And it's some of those simple things. And of course, you have to have the credibility to be able to do that, and you have to have the relationships in place to do that. But those are the simple things that you're looking for. If patients are sitting in the waiting room waiting to be just put into a room to see the physician, if you're behind the front door of the practice, you can observe, do they have enough MAs to do that job? Are the patients waiting because they're understaffed? Are there people just not quite sure what their role is? And I think one of the most important roles that a rep can play, especially for the people that are front and center with these patients, whether an initial phone call, initial appointment, or even people rooming patients, is to educate them on the products and procedures that are of most interest to them. Because those are the people that get questions. So when somebody calls in and says, hey, I saw Dr. Smith's ad, can you tell me a little more about this procedure? If the person answering the phone says, or maybe I've seen situations in practices quite often where they actually have a negative view of that procedure or of a specific treatment that is going on in that practice. And, well, I don't know, that seemed, that's done in our office and it seems like the patients are in pain. I mean, you have to manage all of that. And the best way you do it is proactively with training. And the rep can be an integral part of that.
Yeah.
Is an integral part of that.
We see that where a practice is trying to grow and create their ability to scale. So the physician brings on nurse practitioners or PAs and incoming calls requesting appointments. The person answering the phone, they go to book the appointment and the person says, okay, I'd like to see Dr. Smith. And they go, well, I could get you in earlier with the PA. And it's just, they're basically telling you, this is a really bad idea I'm supposed to ask you about.
Yeah.
And, it matters. The tonality of what that person says, you nailed it with procedures. Oh my gosh, I saw someone bleed so much from that procedure. So I'm going to not speak nicely about it to incoming patients. And from our perspective, I know I've been nervous to point things out. And we have something internally here that we call, and this may be a little gruesome to think about, but we refer to it as keeping kids out of the street. If you see a kid walking into the street, you don't go, oh, wait, that's not my kid. You grab the kid, you get them out of harm's way. And so we feel that about business. If we see that someone is sabotaging appointments, it might be nerve-wracking. It might go, gosh, what if this is someone the physician really likes? Or what if it's a family member? The thing is, you got to grab that kid out of the street. They will, I find, and so I'm probably going to get screwed by this later, but I find that they will be appreciative with the hard information because they don't know that that's going on. They don't know that they're losing patients because of that.
Yeah. And I think if you're always problem solving oriented, so you're bringing up challenges that you've observed, but you're also proposing a solution that you potentially as the sales rep can offer yourself. So like a good one again is training. Hey, they don't seem to be comfortable recommending or talking about this procedure. Let's schedule a lunch. I'll bring lunch in and let's train the staff so they're better able and they can ask you, the physician, questions about the procedure if they're reticent, or me as somebody who supports those procedures, or any number of people, and make sure people are comfortable. So I think that the best career advice I got much too late in my career, but I'm glad I got it, was get comfortable being uncomfortable. And the sooner you can get yourself to a position where you are comfortable having more challenging conversations, perhaps delivering news that you perceive as bad, the better off you're going to be in your career, because that's where all things grow and develop in those moments when everything's comfortable. And if everybody's always seeking comfort, nothing's going to grow and develop. That's not where we grow and develop as people or as a business. So that part is crucial to work through some of those. In sales, Clark and I work together. So the worst thing somebody can tell you is no. And so if that's the worst thing, you go spend your time elsewhere.
Right.
So if the worst thing somebody can tell you is no, I don't want to do business with you and you offended me, like, okay, I respect that. I'll maybe come back to you and I'll go talk to your competitors down the street. So you have to get comfortable being able to have those conversations and turn around and walk out the door if needed.
You mentioned working together, Amy. One of the things I learned from you and a few other ridiculously awesome professionals at our time at Intellis was aspects of getting deep into practice. And a quick story to highlight a couple of the high points that you've already hit, and specifically going towards the notion that the team around the physician can help or hurt, your own mission as a med device or, biotech professional trying to push your most important thing, right? Which is the therapy and the device. I'm having a training session with the MA staff and the folks that were answering and setting appointments at a particular customer's office. And the physician's kind of bumping their head up against the wall because they keep trying to schedule patients because they've had amazing results for the therapy that we were offering at the time. And patients just weren't biting. And he couldn't understand why, because a lot of these patients were patients of this practice for a long time. He had a lot of trust with them.
Mm-hmm.
So I'm trying to uncover what's happening here, right? Is there a process issue? Is it is it the way that it's being framed? What I came to find out, and through talking with the staff and trying to engage them in the process, was one of the team members that was actually calling to schedule the appointment after they had run insurance and things of that nature was essentially telling the patients that they didn't need to do this. This was going to cost too much. And it's because the economics in the office with this therapy were higher than what they saw come from the professional fees for the physician in the OR. So that was an issue, right?
Mm-hmm.
But it gave me an opportunity, that black swan, if you will, that I uncovered, gave me the opportunity to really walk through the whole picture of what happens to that patient.
Mm-hmm.
If they're appropriate to go to the OR, what happens there? And the facility fee, the bill that they don't see for that, the anesthesia bill that they don't see, that the global economic impact of that patient was much greater if they were taking another therapeutic route. And that really opened the eyes of this young lady who was really just trying to be empathetic to the patient, right?
Right.
So, yeah, she had the best intention at heart, but it was ill-guided. It had a limited set of information.
Yeah.
And man, that lesson stuck with me throughout my career to this point, because I just realized you've got to turn every stone over with your customer.
Mm-hmm.
Yeah. So go back.
Yeah. And you have to dig in.
Yeah. Go back to that person reading the magazine, not paying attention. And you just go, well, this guy doesn't do any procedures. I shouldn't waste my time here. And it's literally one scoop deep and you're hitting diamonds. Right?
Absolutely.
Mm-hmm. And I think that's another piece of education that reps can take on themselves, of their own learning. A medical practice being a business, we know how we get paid. We sell things, we get the money, and then we get a paycheck for each of us. Medical practices, the way they get paid is much more complex.
Yeah.
First of all, patients have to come in the door. It starts there. And then there's private insurance, there's Medicare, what plans are accepted, what's their contract rates. It's a very complex business to run. So the more reps and others at a company can educate themselves on how that works, and then also in turn educate other staff members who aren't as involved in that process. So typically the physician will know exactly how much they get paid and how that money comes in. The billing person will know how it gets billed and the accounts receivable that come out as a result of what gets billed. But most people, the rest of the people in the practice, probably don't necessarily have a lot of knowledge about that. Right. And it's very complex, that can be easily broken down for people to understand, to your point and your example.
Yeah, absolutely.
I know that in your career, you've shared this with a lot of reps in the field, and I'm going to guess that not all of them grabbed a hold of it and used it. Is there any, if I'm right, so first that, if I'm right about that.
You are correct. You're right. You're right. Yeah.
What do you think, from your perspective, what do you think was driving that? Well, I'm not going to do that. What do you think they were concerned about? What was holding them up?
I think a couple things. To be frank, I think one of the first ones is ego. So a lot of reps that get into this field like working with doctors. They like the role they play as a partner to a physician, and they like that relationship and kind of how that works. So being a professional with another professional, and, and most reps in our field are very well paid. And so I think it's that relationship that drives a lot of people. And then the competition with another, with their competitor in the medical device space. So it's this kind of kill or be eaten, and deriving all of that satisfaction from the physician. And so I think you have to put that aside a little bit and continue to develop the relationship with the physician, but you have to place a value on everybody at a practice that makes that thing go. And I think a lot of people, I've sat and myself watched my own reps that work for me or others. When I was working in a practice, they would come in and talk down to the person sitting at the front desk, or they have no interest in getting to know that person, what motivates them. any investment in time in other relationships beside that physician. So that's the first reason. And then I think the second one that kind of goes hand in hand is just getting comfortable being uncomfortable. So it's comfortable if that's how you've been trained to interact with physicians, have high-level conversations, different conversations than you may have with other people that make up a medical practice. But getting comfortable and learning yourself, there's always something to learn from everybody that you encounter.
Spot on. I mean, there's a lot of pressure. There's a lot of time compression, right, for those sales professionals that are in this space. If you're in the startup world of to any degree, it's probably some sort of 30-day or 3-month sprint that you're running. You've got some pretty lofty growth expectations, so you're trying to do a lot in a little bit of time, and you can get your priorities twisted, if you will, as to how quickly or what's going to be the fastest way there. Some of the best folks I have had on teams that I've been a part of understood that going slow, so to speak, would actually get them there faster. And it sounds like that's essentially what you're leaning to. I, for one, can say that the mind shift I underwent at a certain point in my career was that my priority, the most important thing to me, wasn't the most important thing to the team member answering the phones, the team member rooming the patient, the physician themselves. Because when I walked out and we were done with our conversation, they had 50 other things that were just as important to them that day. And so making it easier for them, but also bringing in empathy or expressing empathy to what they were working through really changed things for me and team members that I worked with in the past. Have you seen something?
Yeah, and I do think you mentioned it. Some of my second best career advice, or equally important career advice, is go slow to go fast. So a former colleague that Clark and I work with, that was our motto, if you will, on our team. And it stuck with me to this day. And I use that regularly in my career now, is slow down, take time to learn, take time to observe, and the rest will take care of itself. Would you rather have one bad quarter or one bad year?
Right.
And so if you just delay the inevitable and you're chasing orders, you're walking into a practice, I need to see doctor, he needs to sign this, I need this PO, I need this PO. One, you sound desperate. And number two, you're turning the person that you're trying to work with to get to that physician into your secretary, which isn't their job. So I think it's really stepping back and taking the time to learn and then apply that knowledge and develop these broader relationships.
The key that you just said there, apply. There's people listening to this and they may be having some aha moments of, gosh, I'm the one that's not paying attention, and they didn't do it on purpose, but they're there, right? So imagine they're whipping out their notebook and they're writing a to-do list, and that to-do list has one bullet point. What would you say is the one thing that they should do tomorrow to move towards this idea? And the way I view it is, if you're just going to the surgeon, I feel like you're building a really tall Jenga tower. It's kind of fun,
right.
But it's going to be a little...
Right.
And if you go the other way, you're building this massive pyramid that is going to be there for thousands of years. So that person who's building the Jenga tower, it's rickety, it's about to fall. What's the one thing for them to do tomorrow?
I think you gave a great analogy. Start with the base of the pyramid. And the base of the pyramid is your own knowledge so that you can have credibility. So it's pretty easy to go, everybody's got customers. So go to a friendly customer and spend one day watching people answer phones, room patients, sit in the waiting room, sit as a fly on the wall in a medical practice, and you will learn more than you even thought possible. And so I think in one day, you could start building that base of pyramid to see what every person's doing in a practice, and then be able to start to build that knowledge and apply that moving forward with the physician, business owner. So to me, it's actually pretty simple. Whoever tells you to go sit on your butt for a day, but it's what you need to do, and bring a notepad and just start paying attention and asking questions too, and be helpful. Hey, can I get you a cup of coffee? Goes a long way. I know you're busy answering the phones, but then sit and listen to them while they answer the phones and understand the challenges those people are dealing with And then everybody in a practice in their individual role has similar challenges. You just have to work to uncover them, and then you can be a solution, is how I view it.
Yep. Pay attention, learn, ask
Mm-hmm.
questions. And there's something that when you're asking questions and you're trying to learn, there are different ways to do that. And we actually have something that may help with that. It's called the Behavior Change Blueprint. You can log on to medicalsalesaccelerator.com, put in your email address, and you'll be able to download the Behavior Change Blueprint. What this is easy to use, immediate, actionable communication tools. You'll download it, and literally you can start using it tomorrow as part of this bullet point that Amy just talked about. It's the Behavior Change Blueprint at medicalsalesaccelerator.com.
Perfect.
Amy, various times of your career, you sat on both sides of the commercial team.
Mm-hmm.
When you were on the marketing arm, did that give you ability to have different conversations, or was the advice or insight that you were seeing in a practice taken differently, coming from somebody that wasn't carrying the bag or trying to actually sell the product?
I think so. I wasn't seen as someone who had something to gain, if you will, from the interaction at a practice. So, everybody in our field knows how this works. Sales reps sell something, they have a quota, they get paid. When you bring in resources aside from that rep, I think it's a great way to leverage others in a company, number one. I think the person in marketing, that's how I learned the most, was going into accounts with the reps. And then I was a better marketer for the company because of that, because I understood the conversations they were having. I understood the objections they were getting. But then secondarily, I was this expert, that, if you will, that came in to give them advice with nothing personally to gain. Obviously, the company doing well, but not my individual sales quota or something like that. And I think that's a critical resource that every rep has, working with counterparts in different areas of the company to help achieve their goals.
For sure. I've witnessed that firsthand, and it's something I've learned a lot from you, frankly. In today's environment, access is more limited, especially to folks that don't necessarily have they're not having continual contact, right? Talking to a lot of reps around the country, it's harder for them to get team members of theirs from corporate or whatnot in to see customers.
Mm-hmm.
One of the things that you can do to pivot on that when you are on the sales side is just address the fact that you are there to grow your business and this part of their practice, right? You're there to sell more,
right,
whatever you have, service, product, whatever. But you've recognized that to get there, it takes more than just pushing a therapy on everybody that needs to get there, right? The patient experience,
mm-hmm,
the above par, the quality of care, obviously from a technical perspective, needs to be there. But if you just go ahead and address that elephant in the room, I've found by watching some really talented salespeople that will help bring that guard down and can allow you to have certain conversations that you sort of mentioned are really powerful from the marketing and physician education.
Yeah, I would agree with that. 2020 has provided all of us with new challenges, and it gets to access. So I've talked to a lot of reps myself that don't have access to ORs anymore. They're not allowed to go in for procedures, especially those that are elective. I think the unique thing about the things we're talking about today, especially in private practices, the practice is actually more accessible than the operating room, whether it's an ASC or a hospital, because the physician's in charge and they're trying to limit the number of people within the waiting room and things and doing social distancing, but you have actually more access at the practice than at the hospital or the facility where other people are coming, other doctors, other procedures, all of that. So to me, this time is a great time to focus on meeting the physician, their business where it starts, and the patients where they start, which is at the practice itself.
Makes a lot of sense.
Yeah.
Have you come across, I'm saying this because I know that sometimes what also holds people up from moving forward is they feel like they're not an expert, so
Mm-hmm.
how am I going to talk to them about business? Have you come across an aha moment from a rep or yourself when something was shared or just connected that just made a massive impact on the surgeon's business. So you recognized something, you made a suggestion, they took action, and there was positive outcome?
That's a great question. The thing that comes to mind first is making recommendations about staffing. I think physicians running a small business are trying to keep their costs down, but having this separate set of eyes that can observe their business, document what is observed, and then share that in an appropriate way. I think the most common thing I see is this situation we talked about earlier, where the people answering the phones are also the people at the front desk. And by making a simple suggestion of having hiring a resource to answer the phone separate from the person greeting patients and taking care of their needs while they're physically there in person, has made the most difference of anything I've seen.
I really appreciate you taking the time today.
Thank you, guys.
It's been really good. This is awesome insight. I hope that you out there, that you're grabbing this, you're making that bullet point, you're going to build that pyramid, take advantage of understanding that you have the ability to witness the things that are around you and help these business owners grow the business that is their practice. It's really good stuff.
It is. If you like what you heard today, hit that little box with the arrow on top, shoot this to your friends, to your colleagues, to your team members. If you're looking for a specific guest or you want to hear about a specific topic, submit that to us via the website, medicalsalesaccelerator.com. Like, subscribe, pass this on. We appreciate you, and have a great week.